Welcome back to Pain Diaries. I am going to have a special welcome to Lola Clay of Zen Imago. Hey Lola, thanks for being here. Tell us a little bit about yourself.
Hi there, Doc. Thank you for having me. So I am a licensed professional counselor supervisor in private practice here in the Houston area at Zen Imago, PLLC. And I do a lot of public speaking, mental health education, and total comprehensive psychological care.
Awesome. That is why I'm so excited to have you on the show, because we really need to address mental health. And mental health in my world of pain management and obesity medicine is huge. So I was hoping you can kind of touch on some of those things that you're an expert in, and we can help patients realize what kind of resources are out there if they need anything like that. So what would you say some of the greatest barriers are to people seeking psychotherapy?
So there are lots of barriers when people want to seek psychotherapy, but the primary barriers that I tend to see are shame, finances, and overall access to care and where to start seeking treatment. And so I like to let patients know that there are lots of directories out there online that can help them in the process of finding a practitioner that's going to work for them. One of those sources is Psychology Today. That's a great resource. And also, if a patient is insured, it's important to start with your insurance and a list of practitioners to see if they're covered by your insurance. And also, you can even break down criteria specific to what it is you're looking for. Are you looking for male? Are you looking for female? Are you looking for LGBTQ friendly? So all of those are some things that people can look at when they're seeking a practitioner. And in terms of shame, there's still a lot of stigma associated with mental health. But when asked the question, who needs therapy, I like to say everyone needs therapy.
That's a great answer. How do you know if, you said check the insurance. How often is it actually covered?
Actually, psychotherapy is really covered pretty often, and especially since COVID, that's been one of the fascinating and positive byproducts of the COVID pandemic, is that mental health was thrust into the forefront. And so now insurances are more likely to cover mental health because it's being seen more as preventative and interventive medicine.
Right, yeah, a lot of bad things came out of COVID, but a lot of good things as well, such as, the psychotherapy, and for us, telemedicine. It's been a huge, amazing resource that we never even touched on before.
I'm so glad that you brought up telemedicine, because virtual access to psychotherapy is everywhere now. So there's really no reason for time constraints or location to be a barrier to receiving positive help in that area. And there are also avenues where there's even texting for psychotherapy now. So there's no excuse not to get the help that's needed, because it's literally so easily accessible at your fingertips. And you'd be surprised, but it's still quite possible to establish a very good rapport with someone virtually. It's just important that if you are going to go the virtual track, that you take your therapy seriously and make sure that you are in a location where you have privacy for your sessions and where you can focus and not be disconnected or distracted during your sessions.
Absolutely, that's a really important point. So you have a focus on whole wellness in your practice. How do you actually define that?
So I define whole wellness as mind, body, and soul connection from the top down and bottom up. It's important that we treat ourselves mind, body, soul, and spirit. And so you want to address the whole person in all areas of their lives: social, professional, personal, spiritual. All of those are really aspects of personhood that can't be ignored or denied.
Absolutely. Yeah, the whole body, the whole mind, the whole spirit, the whole thing is, you want to be able to treat that person, and you need to know all aspects of what's going on. So that's really important.
Yeah, and a lot of times people put a lot of pressure on themselves or worry when they think about coming to therapy because they think it has to be one specific thing. And sure, if you just want a solution focused approach, then you can go to therapy for one thing. But ideally, it's an unfolding process and unpacking in all the different areas of your life so that things can come together more cohesively and you can start living a life that is authentic and integrated with all the different parts of self.
So does that approach really play a role when you work with your weight management patients?
It absolutely plays a role when I work with weight management patients because the mind is a powerful thing. And so unless you can get a handle on the cognitive distortions and the discrepancies that can lead to weight-related issues, then you would be lost without those components. And for example, one thing that I see, you will see people that say, I want to get this weight under control, I want to manage my health, I want to manage my nutrition, but their attitudes and their actions are out of alignment. And that's because of faulty thinking and a negative internal dialogue that can get going sometimes that really makes it a challenge for people to maintain steadfastness when they're trying to manage their weight.
That totally makes sense. So what should someone with weight management goals look for when they're actually searching for a therapist?
So it's important when a person with weight management goals starts seeking a therapist, you want to seek a therapist with experience. And you also want to make certain that the person is able to thoroughly assess you. So you want to be assessed for any other conditions that may be leading to your distortions associated with food, exercise, eating, overeating, undereating. So you want to make sure you get a full comprehensive assessment, and you want to rule out anxieties, depressive disorders, other serious mental illness. And also you want someone that's going to take in your lifestyle into account, because what works for one does not work for all. And so client specific treatment is really, really important.
Absolutely. I mean, I find that being a physician too. I mean, you have to meet the patient on their path. You don't want to necessarily jump all the way ahead or start all the way from the beginning if they've already done those certain treatments and they didn't necessarily work for them. So meeting them on their path.
I love that you mentioned that, meeting people where they are, because a lot of times I think people don't give themselves enough credit for what they've already accomplished. So they think that they're starting over at square one, when no, if you've lost 80 pounds before in the past, but you've gained 50 of those back, that doesn't negate the hard work that you put in to lose that initial 80 or the skill set that you have. You just need to be able to refocus and start again, but it's not starting completely over.
No, absolutely. And I always applaud people. You know, losing weight is hard. And, you know, if they have done even 5 pounds, like, hey, you're on the right track. You didn't put 5 pounds on, you lost 5 pounds, and you're going towards your goal. So, you know, that encouragement and keeping people going is just so important. Keep people positive.
It is, and like I like to tell clients, some is better than none. So don't underestimate the power of what you think a small victory is. A victory is a victory regardless, and nothing beats a failure but a try.
Absolutely. So I know we talked about weight management. Your practice also addresses chronic pain, another one of my passions. What are some of the issues your patients typically describe?
You know, the most significant issue that chronic pain patients deal with would be that all the time the disorder doesn't necessarily show on the outside. For lots of people it does, but for a lot of people with chronic pain, they run into trouble with friends, family members, employers, just not necessarily believing them. And so that can take a real toll on a person's life. And everything has to be planned around those good days. Right. And so helping a chronic pain person accept their condition as a condition that requires a lifetime of management, that's super important. And also working with the person to determine what path is best for them. There are some people that have aversions to medication management of their chronic pain.
Right.
And so if that's the case, there are other things that can be done: body work, breath work, guided visualizations, all sorts of techniques that they can learn to help minimize and manage their pain.
Absolutely. I feel like I have this conversation with a lot of patients because they say, hey, my husband, he just doesn't get it. Like, why doesn't he understand that I have a disease and my disease has a name and there's actually a specialist that I go to for this problem, and he just doesn't get it? And I'm always thinking, like, okay, well, we really need to educate him. I've never met this person, so maybe we need to bring him in and we can start the education. Or I can refer him to you.
Absolutely, and I'm glad that you say that, because that's an important part of dealing with any disease or disorder, is making sure that the patient feels empowered enough and has enough information to educate the people in their lives about their condition. And oftentimes I do tell the person, you know what, bring your kids, bring your spouse, bring people that are close to you so that we can let them know how to best live with the person that's living with the disease, because it can be a very isolating and lonely experience for the patient. So getting that support system intact is super important.
Absolutely. So you obviously think therapy is important for people struggling with weight and chronic pain. So how do you think this can help people identify the best form of intervention for them?
Well, it can help because sometimes just giving yourself the space to hear yourself speak out loud and process some of the things that you're going through, it helps facilitate healing in the sense that you can map out an action plan. So an action plan is really important. And so the first step is to take the big step of saying, you know what, I need to speak with someone, and making an appointment to go in. And then the second step is making that commitment to adhere to treatment recommendations. That can be really difficult for people because we all just want to be thought of as normal. And so anything that veers us off of being identified as normal can be intimidating. But just being able to take that step and say, you know what, I'm a person with differences, and I'm going to manage those differences.
Absolutely. That is so important. Let's talk about the myths. Some people have myths about therapy. Can you dispel some of that?
Yes. The main myth of therapy is that therapy is for, quote, crazy people. And there are no crazy people. There's just a crazy world and crazy things that happen to us as a result of living in this crazy world.
Wow.
So taking that away completely and recognizing that, nope, therapy is a lifetime endeavor, and you can work on so many aspects of your life over time with a therapist that it can be amazing. So dispelling the myth that you have to be crazy to seek therapy, and the myth that it's astronomical in costs, because that's a myth too. There are great clinicians for all socioeconomic levels. There are great clinicians out there that offer services completely free. And so there's something for everyone.
Absolutely. That is so awesome. I'm so glad you said that. And this May is Mental Health Month.
Yay.
So Mental Health Awareness Month, here we are. What are some of the mental health tips that you recommend?
Okay, so since May is Mental Health Awareness Month, I always like to give a couple of quick tips. The first is check your sleep hygiene. Are you sleeping too much, not enough, waking up in the middle of the night and can't get back to sleep? If any of those sound familiar, get it checked out. See your physician and find a way to get more sleep. Quality sleep is important. Number 2, boundaries. Learning to say no. Saying no when needed can make an immense difference in your life, and then saying yes when needed. Say yes to maybe going to a movie on a weeknight. Say yes to going to a concert with a friend when you feel like, oh, but I would benefit so much more if I just work these 3 hours. No, sometimes saying yes can be really important.
Absolutely.
Yes.
Well, thank you for that. Now, can you share your contact information with people? Because you have so much to offer, and I would love for them to be able to contact you.
Okay, so you can contact me at imagopllc@gmail.com if you just want to shoot me an email, or go to our website, www.imago-pllc.com, on Instagram at The Real Lola Clay, and on Twitter at Lola Knows Truth.
Amazing. Lola Clay, thank you so much for being here today. We had hardly scratched the surface. That was just such a great intro. So thank you so much.
Thank you for having me. This was a pleasure, and thanks. And thank you for the hard work that you do in helping to heal people every single day.
And you too. Thank you.